Hello, my zebras and spoonies. Thanks for coming and hanging out with me today. I am glad that you are here. Today, I'm going to be talking about my experiences with endometriosis, and this is an installment in the My Diagnosis series. It has been a while since I made a post in this series, and there are several more that I plan on making. There just have been other things that have been occupying my mind, and thus I've been posting about those other things rather than about my experiences with my various diagnoses. But I do plan on finishing this series. I promise I haven't forgotten about this. So this video comes with a trigger warning. It's going to be focusing on the menstrual cycle and pelvic pain. I'll be going into some detail, which some will consider to be graphic. And I am aware that discussion of these topics can make some people feel uncomfortable. If you are one of these people, then this video is not for you and you should stop watching at this point. So if you're still here, then let's get into it. I have always had trouble with my menstrual cycle right from the beginning. I have had an irregular menstrual cycle, and this in and of itself isn't abnormal. Many young individuals with a uterus who are first starting their cycle will be irregular for years before it sorts itself out. I was very young at 9 when I started my cycle. The younger you are when you start your cycle, the more likely it is to be irregular. However, my cycle has never become regular. Even now, it is still irregular, and I am 41. This isn't something that the doctors became concerned about until I was around 17. And generally speaking, it's about 16, 17 that doctors expect that your cycle will become more regular. When I was 16, I started having really heavy bleeding with my menstrual cycle. And just for your information, heavy menstrual bleeding is defined as needing to change your tampon or your pad more frequently than every 2 hours, or if you are passing clots that are larger than a quarter. I personally never passed large clots, but I would have to change my pad every hour and sometimes more often in order to manage the amount of bleeding that I was having. Every time I was having my menstrual cycle, my H&H was dropping significantly. And H&H is a pair of lab work values, the hemoglobin and the hematocrit. The hemoglobin measures the level of hemoglobin, which is the oxygen carrying protein in your blood. And the hematocrit is used to determine the ratio of the red blood cells in the total volume of blood. And these two tests together are used to determine if someone has anemia. And if they have anemia, it is used to determine if that anemia has become severe enough that they need to have blood transfusions. So when somebody is actively bleeding, they monitor the H&H closely to track where you are in your anemia. And when I was 17, I was put on oral birth control because my H&H got dangerously low. It was low enough that there was some discussion of my getting a blood transfusion. The hope was that the birth control would decrease the amount of bleeding that I was having and would help make my menstrual cycle more regular. It did decrease the amount of bleeding, but the estrogen birth control caused me to have psychosis. So I was switched over to a progesterone-only pill. This did not regulate my menstrual cycle, but it did reduce my bleeding to normal levels, and it didn't affect my mental health. So I have been on a progesterone-based birth control ever since then. I was 19 when my daughter was born. After she was born, I had an increased amount of pelvic pain during my menstrual cycles. I was put on a Depo-Provera shot after my daughter was born, and this was so that I would get a more consistent hormone level. I used this birth control for years. It never reduced my pelvic pain. Despite the pelvic pain, I was never given pain management beyond being encouraged to use a heating pad and over-the-counter ibuprofen. When I was 20, I had a miscarriage. After that, I had another increase in my pelvic pain. This is when I was first worked up for concern for structural abnormalities. I had an ultrasound and a CT scan of my abdomen. Everything looked normal. The doctor gave me the diagnosis of endometriosis at that time. It doesn't generally show up on any imaging. That's important to know. The only sure way to diagnose endometriosis is to perform an exploratory laparoscopic procedure, which is when they go into the abdominal cavity. They look around at the structures and they take tissue samples. Those tissue samples are then looked at under the microscope to see if there's any evidence of the endometriosis. I've never had this done. I was diagnosed with endometriosis because the doctor felt that I had the right symptoms and that it was the most likely cause given the normal imaging and my age. Despite this diagnosis, I still wasn't given anything to manage my pain. When I was 21, I had a third pregnancy that I chose to abort. After that, I had yet another increase in my pelvic pain. I had another workup with imaging that was all normal. The doctor kept the endometriosis diagnosis and continued to not give me any pain management. When I was 29, I had another significant increase in my pelvic pain. This time, there was no apparent trigger to the increase in my pain. I had another workup with all the imaging coming back normal. I was seeing a different doctor then, so they also had a bone density test done. I was on the Depo-Provera shot for a long time. It was then that they found that I had osteopenia. Because of this, I switched from the Depo-Provera shot to using the Mirena IUD, which was first placed shortly after I turned 30. I was put on calcium and vitamin D supplements to try to help my body rebuild my bones, but still no new pain management. At 35, I had another bone density test done, and it reflected that I had normal bone density, so yay, my bones recovered. Now at 41, I am still struggling. I have again had imaging done, and this is reflecting nothing abnormal. I am still using the IUD, and that is doing a great job at controlling the amount of bleeding that I have. My menstrual cycle continues to be irregular. I can have a period that lasts 3 days, or I have had one that lasts as long as 3 weeks. I have had periods that come every other week for 6 periods, and I've had times that I've gone as long as 4 months without a period. Then there are stretches that it seems to be on a regular pattern, but this never really lasts for very long before it becomes super irregular again. So I have again had an increase in my pelvic pain, and I don't have a clear trigger for the increase in pain. Despite the severe pain that comes with or without my menstrual cycle now, I have not been given anything to control my pain. I'm still doing my best with the heating pad and ibuprofen. Doesn't matter that the ibuprofen sets off my mast cell symptoms. There are just some times that the pain is so bad that I have to use something, and that's all I have. It only takes a little bit of the edge off, but it is better than doing nothing. So this adventure that I've had with pelvic pain is probably the biggest reason that I have lost my faith in the American healthcare system. And I found myself feeling angry towards healthcare providers. There are honestly times that I am ashamed to be amongst their ranks. I was told that since it was endometriosis, I could just wait until menopause, since that was likely to resolve the pain. Yep, that was one doctor's solution to the pelvic pain. Just live with it for about another 10 years and then hope that the pain goes away. There hasn't been a single doctor that felt that this was something that I should get pain control for. And it doesn't matter that the pain has gotten bad enough that I've had to call out for work. And it doesn't matter that it gets bad enough that there are times that I cannot walk. And it doesn't matter that I am now having the pelvic pain literally every day. This just isn't something that gets medicated. For 21 years, I have carried around the diagnosis of endometriosis, and the truth is that this isn't even a confirmed diagnosis. I finally found a doctor that was willing to do the laparoscopic procedure to confirm the diagnosis, and I wasn't able to get the time off from work. So I am left still not knowing if this is even the right diagnosis, nor do I know when I will ever be able to make the arrangements that are needed to have this procedure done. For 21 years, I have been having pelvic pain, and the doctors feel that it is fine to not be sure of the diagnosis and that it is fine not to have pain management. This is the American standard of care. We need to do better. Well, that's about it for my rambling today. Thanks for coming and spending time with me. If you like the video, please click on the like button. It really does help. And until we talk again, you guys take care of yourselves. Bye.